So first up is the tibialis anterior and dorsiflex. Tibialis anterior is the muscle belly. Its origin is the lateral epicondyle of the tibia, and it comes down and crosses over and attaches at the first metatarsal, base of the first metatarsal, and it does dorsiflexion and inversion of the ankle. And for manual muscle testing of that, you can put them in that position and you try to force them out of it. So, ready?
You're welcome.
1, 2, 3, 4, 5. All right.
Okay, now we're going to do the extensor hallucis longus, which is on the middle anterior surface of the fibula. That's its origin. And then it inserts on the distal phalanx of the first toe, and it dorsiflexes and inverts. So the manual muscle test, can you extend your big toe? Ready? 1, 2, 3, 4, 5.
Okay, so now we have the extensor digitorum longus, and it starts at the lateral condyle of the tibia and the anterior shaft of the fibula, and it comes down next to the tibialis anterior and connects to the toes 2 through 5, the flange 2 through 5, and it extends all 4 of them. So go ahead and extend. So the manual muscle test for this is to try to force them out of that extension. 1, 2, 3, 4, 5. Okay, so now we have the peroneus tertius, which starts at the distal third of the anterior anterior compartment of the fibula, and it comes down and it connects to the base of the 5th metatarsal, and it does eversion and dorsiflexion of the foot. So in order to test this, you brace and you try to force it into plantar flexion and inversion. Ready? 1, 2, 3, 4, 5. The extensor digitorum brevis, which starts at the dorsal surface of the calcaneus and wraps around and connects to the 2nd through 4th metatarsals through the EDL tendon, and they help extend these 3 toes. So again, to check them, make sure it's working, you just pull it down for 1, 2, 3, 4, 5.
So next we're going to do the peroneus brevis. The origin of this is the lateral or the distal 2/3 of the lateral fibula, and it's a deep muscle, so it can't be palpated, but the insertion is the tuberosity of the 5th metatarsal, and the action of this is eversion. So to test this, we brace and push the foot into inversion. Ready? 1, 2, 3, 4, 5. Next, we're going to be doing the peroneus longus, and the origin of that is the head and proximal 2/3 of the lateral fibular shaft, and then the insertion is the base of the 1st metatarsal and cuneiform, the plantar surface of that, and the action is eversion. So to test that, we're going to start in plantar flexion and force into dorsiflexion and inversion. Okay, ready? 1, 2, 3, 4, 5.
So today we'll be taking a look at the gastro. The origin is the posterior aspect of the femoral condyles, which is up here, and then the insertion is the calcaneus and the Achilles tendon, which is this guy right here. And the action is plantar flexion and knee flexion. So today we'll be testing her gastrocnemius. So I'm going to hold her right here, manual muscle test. I'm going to tell her to press the gas. All right, go ahead. 1, 2, 3, 4, 5. You take a look at the soleus, which is underneath the gastro, which we just looked at. The origin is the posterior fibular head, soleal line of the tibia, and the posterior cervix of the tibia. And insertion is the Achilles tendon down here via the gastro and the Achilles tendon. And its action is plantar flexion. So we'll be taking a look at this today, see how hers are. So we're going to put her knee up like this, and it's very similar to the gastro. We'll tell her to press the gas. 1, 2, 3, 4, 5.
Okay, now we're going to do the flexor digitorum longus, and its origin is the middle posterior surface of the tibia, and it inserts at the distal phalanges of toes 2 through 5, and its action is flexion of toes 2 through 5. So the manual muscle test, can you flex your toes? And then I'll push down on them. Ready? 1, 2, 3, 4, 5. Now we're going to do flexor hallucis longus. Its origin is the posterior distal 2/3 of the fibula, and it inserts at the distal phalanx of the first toe, and its action is flexion of the first toe. So the manual muscle test is flex your first toe, and I'll push down. 1, 2, 3, 4, 5. Okay, now we're doing the flexor hallucis brevis, and its origin is the plantar surfaces of the cuboid and lateral cuneiform, and then it inserts at the medial and lateral surfaces of the base of the proximal phalanx of the great toe, and it flexes the great toe. So to test it, we're going to push down on his great toe. 1, 2, 3, 4, 5. Okay, now we're going to do the tibialis posterior. Its origin is the proximal posterior shafts of the tibia and the fibula, and its insertion is all 5 tarsal bones and the bases of the 2nd through 4th metatarsals, and its action is plantar flexion and inversion. So to test it, I would push it into eversion and dorsiflexion. 1, 2, 3, 4, 5.
So now we have the flexor digitorum brevis. Its origin is the medial process of the calcaneus and the plantar aponeurosis, and its insertion is the 2nd through 5th phalanges, and its action is it flexes 2nd through 5th phalanges at the pip joint. So go ahead and flex. And the way you test it is they flex their 2nd through 5th, and you try to force them out of that flexion. 1, 2, 3, 4, 5. And now we have the extensor hallucis brevis, and its origin is the dorsal part on the calcaneus, and its insertion is the proximal, part of the proximal great toe, so right in here, and it extends the great toe at the MP joint. So go ahead and extend it, and the way you test it is you force it out of that extension. So 1, 2, 3, 4, 5. The anterior draw test. This tests the injury to the talofibular ligament. The athletic trainer must brace right above the malleoli and then pull the calcaneus forward. A positive test is signs of pain or sliding of the talus.
Any pain with this?
The talar tilt test. This test tests the extent of inversion and eversion injuries. The athletic trainer must stabilize at the ankle and grab at the forefoot and move the foot in eversion-inversion motion. A positive test equals laxity in either side or pain.
Any pain?
The Thompson's test. This test to see if the Achilles tendon is fully intact. The athletic trainer must squeeze the gastrocnemius, making the calcaneus move upwards. A positive test is there's no movement in the calcaneus. The percussion and compression test. This test to see if there's fractures anywhere in the lower leg or the foot. The athletic trainer must hit the heel of the foot, the calcaneus, with the heel of his own palm. A positive test indicates pain at the site of complaint. For the compression test, the athletic trainer must squeeze the metatarsals or the tibia and fibula together. A positive test is pain at the site of complaint.
Any pain?
Now we're going to palpate the bony landmarks of the medial aspect of the foot. So first is the calcaneus, just back here. Then the medial malleolus, the sustentacular tali, the talar head, the navicular tuberosity, the first cuneiform, right here, and then the first metatarsal, and then the MP joint. Now we're going to palpate the bony landmarks of the lateral aspect of the foot. So we have the lateral malleolus, the sinus tarsi right here, that's this divot, the calcaneus, the perineal tubercle, the cuboid right here, the styloid process of the 5th metatarsal, then the 5th metatarsal, and the MP joint.
Now we're doing the arches of the foot. First we have the medial longitudinal arch. We have the lateral longitudinal arch, which is a lot closer to the ground, not as steep. Then we have the metatarsal arch and the transverse arch.